So that's part of doing business in this world we live in today. And that's what you need to understand. DEI is not a nice thing to do. It's because it's going to be the thing that we need to do in order to sustain the livelihood of our healthcare institutions and our businesses.
Welcome back to Leadership Beyond Burnout. I'm your host, Dr. Kimberly L. Wilson, and for those of you that are new here, we welcome you as well. And just a little about our show. We help people to create lives they love by bringing you the change makers of today, people who are making a difference in the world, and ordinary people who share their strategies to relieve burnout and some of the amazing work that they're doing in our community. Today, we have a very special guest. I'd like to introduce you to James C. Burroughs. James C. Burroughs II is the Senior Vice President of Government and Community Relations and the Chief Equity and Inclusion Officer at Children's Minnesota, which is one of the largest freestanding pediatric health systems in the nation. James's key focus areas include patient quality initiatives, employee recruitment and retention strategies, organizational culture, increasing the financial investment with diverse businesses, and initiatives that address the social determinants of health for patients and families. James also leads efforts to advance community relations and champions policies that improve children's health and well-being. James has more than 30 years of experience in nonprofit management, equity, diversity and inclusion, and employment law. Prior to Children's Minnesota, James served in the office of Governor Mark Dayton as the state of Minnesota's first Chief Inclusion Officer, also making history as the first state Chief Inclusion Officer in the country. James serves multiple nonprofit boards and on behalf of Children's Minnesota and other corporate and nonprofit partners. James founded the Minnesota Business Coalition for Racial Equity. He is also a member of Omega Psi Phi Fraternity Incorporated. James earned a law degree at Georgetown University and completed his BA in political science at Morehouse College. He is the proud father of Teresa Ann Burroughs. And without further ado, let's introduce you to James. Thank you for being on board, James.
No problem. Hello, Dr. Kimberly. How are you?
I am well. I am really excited. In addition to all of those accolades, we are also alumni together, high school alumni. So that's really special for me to be able to bring you on.
Well, that's cool. I was going to put Cas Tech on there, but it got even much longer. So I was like, no Cas Tech 85, devastated and alive. We just keep that in our back pocket.
That's right. Bring it out when necessary. So I would love to for you to share with us some of the things that brought you to be involved in the diversity, equity, and inclusion. Was there something in your childhood, or was it experiences growing up in college?
So good question. It didn't start until probably practicing law for a couple of years. So after college, I went to law school, wanted to be at the time, a sports and entertainment attorney. So I wanted to represent athletes and do those things, representing people that I couldn't do on the football field since I retired my career after high school. But then I got attracted to doing employment law, and employment law helped me understand how people drive businesses and how, as an employment lawyer, you can help businesses with good practices around people, making sure that they don't discriminate against people, women included, people of color, and also people with disabilities. So got attracted to that kind of law. And after practicing law in that area for about 2 to 3 years, I realized that a lot of companies were doing things by accident. Like none of my clients were intentionally discriminated against a group, but if they didn't know any cultural nuances or differences between black people and or a majority race and or religious holidays that are Muslim or not, or gender issues or paid leave, and that you should treat women a little differently if they got on pregnancy leave, you shouldn't give their job away. A lot of folks were doing things that were in violation, just didn't know it. So I said, hey, I want to get involved on the other side of that, learn more about diversity and inclusion, and see how I can be a proactive person and making sure that companies do the right thing around inclusion and equity.
I think you've just said something that I don't think I've ever heard from any DEI experts, and giving the grace that companies unintentionally engage in some of these behaviors. A lot of times you see it's almost an adversarial uh, type of relationship when bringing that in, and like almost finger wagging. So I really appreciate the fact that you give them the benefit of the doubt that they don't know
Mhm.
what they don't know.
You have to almost, because I mean, you and I grew up in Detroit, Michigan, and at the time, Detroit was a majority black city because of the riots in the '60s, and a lot of white people moved to the suburbs. And I can't imagine some of my white colleagues in Minnesota never grew up with people who look like me, never
Right.
knew grew up with people who were from a Muslim faith or other faiths, never grew up having to understand anything but their, as my former boss used to say, Norwegian and Finnish culture or Swedish culture. The Swedens were the diversity. And then I come in, others come in, and not necessarily saying that people, after one or two times, is no longer an accident, but the first one or two times, you don't know what you don't know. And I always start with grace and saying, okay, let's explain. Let's talk about these differences. Let's talk about our similarities and how we can work together as well. When people come in with that adversarial attitude, sometimes I think it gets in the way, because if you came in and said, James, you're discriminating against me because I'm a woman, and I made an accident or a mistake and said something unintentional, I said, Dr. Kimberly, I apologize for that. I didn't know. I'm learning. And you said, okay, well, I'm going to give you grace. I'm going to then approach that differently than if you call me a sexist every time you see me, or tell your friends I'm a sexist and never want to speak to me again. So I always give grace to start with. Now, I understand grace only goes so far. Like once you make the mistake once or twice and I say, do something different, and you keep doing it, then your intentionality shows me what you want to do, and then we address it in a different way.
Absolutely. Now, I'm curious, have you seen it very challenging for leadership roles? It seems like there are a lot of new things to learn with regard to social politics, whether it's the LGBTQ plus community, diversity, inclusion, and belonging. Um, how have you seen them handle just the burnout and the stress of trying to ensure that they're doing the right thing?
It's hard. I mean, it's hard in this sense. If you go in not knowing what you don't know, you always want, not always, sometimes people want a shortcut. They'll be like, James, okay, so tell me about all the black people you know, and then find somebody who's gay. They can tell me about all the gay people, and then I'll know. I'll understand. Well, as you know, humankind is humankind, and each individual is different.
Right.
So I'm not like every other black person. You're not like every other black woman, so on and so forth with others. So it's about teaching people patience. And when I tell people who want to learn about diversity and inclusion, is expand your friend base. Expand the people that you hang out with and get to know, because as you get to know different people in different genres, races, sexual orientations, physical ability, all those things, you get to learn about those individuals. And then you can say, hey, I'm becoming more inclusive in my base. In the climate we live in now, it's tough because a lot of folks and politics have made DEI a political issue. Um, I think I heard recently the ship that ran into the bridge in Baltimore. Someone said, DEI was responsible for that because some of the workers on the bridge were of Latino descent. Yeah, something crazy. And I was just
I,
like,
I had
that
not heard that one yet.
that one came out, and then there was the one about Boeing jet, where the jet door flew off, and they blamed DEI hiring because that's why the reason the jet door flew off. Nonsensical things, but a lot of folks are buying into that and saying, well, DEI is to blame for all of this, or DEI discriminates against folks. What DEI is really just the history of this country. So if I tell you the history of this country in 1776 was founded because we left the colonies of England. That's all true. But
Mhm.
also too in 1619, for some reason, somebody started bringing some people who are black over here as slaves. And actually, before 1619, they started bringing over slaves.
Right.
Started not paying them, using them as chattel, abusing their families, their children, their women, and let that continue on through Jim Crow, through discrimination, through the slave codes. And that's history of this country. Does it mean that people of this age are like that now? I'm not saying that at all. But you have to understand that history to understand why we have such large disparities between certain races and ethnicities. You have to understand how gay people were treated in the 60s and 70s to understand why they're fearful of when trans people come into an environment that people may treat them differently and have violence against them as well, because some of that violence still continues because people learn that behavior over a period of time. So when I talk about DEI, it's more about that's who we are as a country, that's who we are as a world. We should learn about the diversity of all of us. Want to make sure we create inclusive environments where everybody can be their best self, and make sure we are equitable in our decisions all along. And that's just being a good leader and being a good person.
Right. So, as this expert in equity and inclusion, what unique challenges have you encountered in addressing healthcare disparities, particularly in pediatric care?
That's a good question. The main one is think about it. The person who is experiencing this disparity is a kid. So first of all, the voice of the person is their parent's voice, not their voice. So if
Right.
it's a kid, a young kid, we're not asking that kid, are you being treated equitably? Are you being treated fairly? They just want good care and to get home to their room and their video game. So it's having an advocate step in for that kiddo when they can. The other piece of the challenge with healthcare is um, healthcare for a long time was in denial about the disparities because they weren't intentional. Doctors take an oath, and that oath is basically do no harm, and that is do no harm to all patients, no matter what race, ethnicity, or gender or sexual orientation. However, unconscious biases, implicit biases, biases taught in medical school. Not too long ago, medical students were taught that people who are of darker skin can tolerate pain better than others.
Yes.
Um, they were taught sometimes that black women could tolerate pain in childbirth better than white women.
Hmm.
And we can see disparities that exist between black maternal health and white maternal health, and the death rate amongst black mothers is shockingly great disparity, and also kids as well. So all of those things contributed to people being in denial for a while. But I will say this: healthcare said, okay, we want to do something different. We want to address these disparities, and we want to. Some hospitals have said we want to invest in this to make sure that all of our patients and families can feel comfortable coming to the hospital. Not too long ago, there was this thing called the Tuskegee experiment, and where we put a whole bunch of black men in a place. We said it was giving you some benign injection, but you were actually infusing them with a disease, and that disease killed them, and you were studying them. And there have been a whole host of mistrust opportunities with the healthcare system along the way. Some of you tell black and brown people, like, hey, trust healthcare. Come to us. We'll take good care of you. The first message is, nah, I'm good. I'm gonna wait to see what you're gonna do, how you're gonna treat people. It happened with COVID. COVID happened, and we saw those disparities on blast in front of the world. That A lot of those disparities led to more black and brown people dying disproportionately than their white colleagues. So, all of that said, the question that you asked, it's tough in the sense that there was a denial for a long time in healthcare about the problem. There is an acknowledgement now that there is a problem. We have looked at those disparities in children's Minnesota and other places as well. But now it's time to act. Now it's time to change the system, which takes an investment in resources, investment in mindset change, and also maybe structure as well to say we're not going to do what we used to do. I don't want any black mother, I don't want my daughter, if she decides to have children going forward, to be afraid to go to the hospital about what might happen to her or her child because she's a black woman. And this has nothing to do with economic status because black women of great wealth, Serena Williams is one, have had mistreatments or maltreatment as black women in hospitals. So I want to change that, and hopefully others want to change it as well.
Right. I had a guest on not too long ago, and she told the story about how, because of inadequate language access, it could have resulted in extremely deleterious impact on her mother, possibly even death. But because
Mm-hmm.
she was there to translate, that she was able to prevent that tragedy from occurring. So I think a lot of times that leaders don't envision all the various ways that we need to take care of people because it's just not your frame of reference.
Mm-hmm. You're right, but you have to understand the customer you serve has changed. So 30 years ago, when I moved to Minnesota, I moved here. The population for Black people was 3% in the total state.
Wow.
So 3%, and then for other minority populations at the time, it was even less than that. Now we're around 22, 23% for people of color total. At our hospital alone, our patients we serve, 40% of them are either Black, Latino, Asian, Native American. We have a larger, much larger LGBTQ population of adolescents that we serve now as well. And we have 120,000 interpretive encounters, so needed interpreters every year, and we have 68 languages spoken. So all of that said, as a system, we should say, man, we have different people coming to us. They're from different cultures and backgrounds. As you mentioned, they need language services because a kid can't even advocate for himself. The parents have to advocate. And if we can't translate for the parents, how are we going to give the kid and family proper care? So that's part of doing business in this world we live in today. And that's what you need to understand. DEI is not a nice thing to do. It's because it's going to be the thing that we need to do in order to sustain the livelihood of our healthcare institutions and our businesses.
Right. I think a lot of times, especially when we talk about children, some providers have felt like, well, the child can translate, and that's adequate. I actually was at an organization being in mental health and was not told that there was a language access issue and they had nothing prepared there. And I actually had to refer this child out because I couldn't adequately serve having to address his behavior problems by asking him to tell his mother what I just this this is nonsensical.
It really is. I mean, 'cause think about it. Even us speaking English at 11 or 12, let's just say that somebody asked me to interpret in English to what my mama, I should tell my mama. I'm going to say something that's a 12-year-old knowledge base, not exactly what needs to be told, not the way it needs to be told, and not that I'm going to understand.
Right.
So you can't rely upon the patient. And some do that in adult systems, and that's wrong too, because it has to be an independent advocate, and it shouldn't be a family member either. We shouldn't require other family members to come in and translate for the healthcare providers. We pay for, the system pays for well certified and trained translators to help with and to translate. It has to be a profession rather than who's going to get the kid to do it and or the relative as well.
Right. So how do hospitals invest in this when I'm looking at current socio-political trends going on and threats of finances being taken away if DEI is instituted? We've seen this mostly in educational institutions. And I just feel like it's going to trickle down to others possibly. So how do they continue to invest and have the integrity in their programs with the threat of financial backlash?
So that's a great question. I'm going to answer from a northern perspective first in Minnesota, and then I'm going to go down south to the states that I know have eliminated some of these things and give my sisters and brothers down there some advice. So in Minnesota, we have a right now a state that's really pro DEI, if you want to say it. Our governor has created a couple of positions. One is chief equity officer for the state, another is chief inclusion officer. They have a chief equity officer, inclusion officer responsible for DEI implementation for the whole state, and they have a staff of people by which they have helped to do that as well. Our Attorney General, Keith Ellison, is an advocate of equal protection, equity. He was a congressperson for many, many years, Muslim, the only Muslim congressperson for a long time before Ilhan Omar got elected. But he is a staunch advocate of equity and inclusion and was a former civil rights lawyer as well. Many of the companies here, after George Floyd was murdered in 2020, doubled down on their commitment and said, we want to create the Minnesota Business Coalition for Racial Equity, which you mentioned earlier that I helped to start. And we want to invest more in strategies to implement DEI and make sure, especially for, this was just for Black employees to get promoted, hired, and also to spend more money with Black owned businesses and invest in policies that affect Black Minnesotans. And that was something that the company said they wanted to do. So by no means are we far above the curve. We still have lots of disparities in Minnesota. There's discrimination that happens, but there is a verbal commitment that has happened, and some of that is translated or trickled down into action at some companies to move forward. And no one has said that if you do DEI, we're going to take money from you. Now I'm gonna go down south. Some of my colleagues down there, I'll start with the University of Florida that chose to, not had to, eliminate their entire DEI department because of laws that are in place in Florida. And I equate it to this: you have to have courage in a time of strife and trials and tribulation. Remember, there used to be laws that didn't allow people who look like us to sit at a lunch counter because we look like us. There used to be
Mm-hmm.
laws that had water fountains that were colored water fountains, white water fountains. If we used the white ones, we went to jail. There used to be laws that put us on the back of the bus, and if we had to move up to the front of the bus, we couldn't. We'd go to jail. There used to
Right.
be laws that prohibited, Loving versus Virginia, white people and Black people from getting married. There used to be laws that prohibited gay people from being serviced in a lot of different areas. So there used to be a lot of laws that are no longer in existence because courageous people decided to challenge those laws, to do what is right in spite of a law that is wrong, to do what is right and implement strategies that are going to value and include everyone in this world, in the state that you're in, despite a law that may be discriminatory, that may be unconstitutional, that may be non enforceable. So I say to my colleagues down south and other places, continue to do what you're supposed to do because it's
Mm-hmm.
going to be beneficial to your company, your business, your government entity or organization. Challenge the laws that may or may not be equitable or equal. And remember that there were all laws before that didn't allow us to do any of these things that we had to challenge and we had to get out of the way and overturn. And that's what we got to do now. So we have to keep fighting forward. And what I try to do too is partner with a lot of those children's hospitals that are in Florida, children's hospitals that are in other states, and see what we can do collectively together. Because you don't have to call it DEI. If I hired you tomorrow and I said, you know what, I don't have a DEI program, but Dr. Kimball, I want to make sure that you get everything you need here, that no one treats you differently because of who you are, that you can bring your full self to work, that anytime you want to make sure you invest in community and do something different, we support you in that and your values, and we want to make sure you have a great work experience. I haven't said the word DEI at all, but what am I practicing?
Right.
Diversity, equity, and inclusion. So sometimes you just have to just do it without saying it too.
That is a wonderful thought. Just change the name. and you can do the thing. When you began talking, you had me really curious as you talked about corporations and collaborations and other hospitals. What does the private practitioner who's serving children, is there a means for them to draw upon some of the resources of larger entities in their area, or is that non-existent?
So give me an example. What kind of practitioners?
Say family physicians or pediatricians, and
Mhm,
maybe it's a small office with two or three docs, and one
mhm,
administrative staff, and they're limited in what they can actually do. And with all these resources that are available at hospitals with translation and policies and procedures, is there any practice to where they can utilize interpreters or get workshops about practices they should be putting in place? Or
mhm. So absolutely, I'll use Children's Minnesota as an example. So all of our physicians that we have at Children's, not all of them are employees. So some of them
oh,
have a practice set up, as you described, two or three docs, some nurses, some clinical staff, medical assistants, and they're an independent entity. They work under the children's umbrella because we allow them the use of our space, our hospitals, our equipment, but they're not employees. So we're not, can't tell them what to do, tell them how to operate. But we partner with them and saying, okay, you're going to be serving patients that are Children's Minnesota patients. You're going to be serving patients in the community. And we want to make sure that you have access to interpreters, access to cultural understandings or cultural humility training, access to making a more equitable environment. And there could be entities that are not even part of Children's, not affiliated at all. We'd be willing to do that. We have a thing called the Collective for Community Health, and that's what we call our community outreach. And within there, we have ambassadors or community connectors who work with our patients and families if they have a food insecurity, need legal help, need housing help. They advocate for the patients and families, give them the resource. We also have within there that we partner with different community organizations who provide services for cultures that some of our patients and families may not receive an understanding of when they come to Children's. So those entities may advocate or partner with us to better understand. A good example is partnerships around sickle cell disease. So my daughter
mm,
has sickle cell disease, and Teresa has had it since she was born. And it's one thing to come in and be black parents with your black child, and then the staff, who's majority white, understand the medical definition of sickle cell, but they may not understand the cultural impact that it's had on my community. So having someone in the hospital system or a partner like the Sickle Cell Foundation of Minnesota, which is a great partner led by a great black woman named Ray Blaylark, who can advocate and partner with us and Children's Minnesota to provide better care. So what I say to the question that you ask is, yes, we do it, and we partner with other community organizations who are collective for community health to do that as well, because it's hard. I mean, some people can't afford to have their own chief equity officer. Some people can't afford to have their senior vice president of government community relations. But you can't afford to not serve the population you have, because once your patient starts saying, you know what, I didn't feel like I was being valued or included or treated well, they start to leave with their feet, and you won't have any patients to begin with. So you can do it through community partnerships and leveraging hospital systems like us.
okay. So don't remain in your little silo. Look out,
Right.
look
Right.
outside for what's out there, because everything is out there.
Yeah, if you need help, I got you. Especially in Minnesota, I can't fly all over the country, but I can get you in Minnesota. But I will say, and jokingly, we also have these things in children's hospitals. Is an organization called the CHA, Children's Hospital Association. So about 30 of us hospital systems have combined to have a collaboration of all of our DEI efforts. So we're sharing best practices, sharing implementation, sharing strategies. So we're not reinventing the wheel ourselves. We're sharing how we got there to help others get there as well. And that's something you can tap into as well as kind of shared models of understanding and learning.
Oh, that's beautiful. I love when they're round tables together and people can grow from others' knowledge and just have to, instead of needing to figure it out. Um, I'm curious, what are some of the social determinants that you found in Minnesota for health disparities, and how have you all tackled it?
Mhm. So we haven't tackled it well. So let me
But you're
just start.
aware of it.
We're very aware of it. So Minnesota, probably most people don't know this, has some of the largest disparities between people of color, especially black populations and white populations in the country. Some of the
Wow.
largest. The main ones we've seen are disparities in healthcare, quality of healthcare, disparities in education, which includes graduation rates, test scores, college entry and graduation as well. Disparities in housing,
Mm,
the housing ownership rate for people of color is much lower, especially the black population, than the white population. We've seen disparities, large disparities in unemployment as well. Although unemployment has dropped tremendously, I think at the rate now is like 3% unemployment in Minnesota overall. I think the number for black Minnesotans is like 6%. It's always been double or almost double as well. And also, too, the income levels have been um, disparity there as well. Trying to think what another area. Um, Food deserts as well. So having food in the neighborhoods that you serve, or just quality access to resources. If you go to neighborhoods that are predominantly neighborhoods of color, you will see a high priced corner store with lots of sugary products and chips and pop and all the things that, I don't know, you grew up in Detroit, but that's what I grew up in and saw all that. I didn't have the A&Ps. I didn't have grocery stores. And, this is a thing that's a reality. I remember in the 80s, I was graduating high school, there were no grocery stores in Detroit anymore. It was like we had to go to the suburbs to go to a grocery store because you didn't have access to quality fruits, vegetables, other things like that. So all of those disparities we have in Minnesota. Now, are we doing some good things to change that? Yes. Our new, she's not new anymore, about a year and a half in, Dr. Brooke Cunningham is our head of our Minnesota Department of Health, and she has
mm,
an entire division focused on disparities and strategies around that, partnerships with healthcare systems to address that. She has people that she's hired to go into community and implement those strategies. We have healthcare systems and insurance companies. Shout out Blue Cross Blue Shield, who has a vice president of racial equity, Bukata Hayes, that have invested in ending those disparities as well and saying we have to look at things differently as well. So there's investments being made, but we still have some of the largest social determinants of health disparities in the country, but we're trying to address those. And we have, as I said before, the Collective for Community Health, which is internal to children's, addressing those social determinants of health for all of our patients and families.
right. And I feel like it's really interesting when you talk about tackling this problem and these issues. I feel as if the communities that are most affected by the disparities would even see the help as suspicious. Like, why are you all of a sudden interested? Is it because it's election time? Or have you not seen that
Mhm.
suspiciousness of support?
Oh no, you have that suspicion, and it's justified. I mean, we have an amazing tool called the Health Equity Index, where which we measure. Right now, we're focused on two main areas: well-controlled asthma and combo vaccines, to make sure
Mm,
that combo vaccines is by a certain age, the age of 2, kids should have a certain level of vaccines to make sure that they're protected against certain diseases. You get some of them early on when you're just born. You have to come back before the age of 2 to get the others. There's a large disparity in who comes back. White kids seem to come back with their parents sooner than black kids because of that lack of trust sometimes and that lack of understanding. We also have a program about well controlled asthma. Asthma is a large disparity, getting treatment for asthma and those things as well. So that trust or lack of trust in the healthcare system is very prevalent, and making sure that we address that. I will also say, too, that in order to address the trust, you have to have co designed problem and solutions that are not just me telling you that this is what we're going to do to you, this is going to make you do. We got to
Yes.
say, you know what? We don't know what to do. So we're going to come in your community, talk with you, work with you. What do you think is going to be best and how it's going to operate? When you do that, you do three things. One is you get a sustained solution that's designed and developed by the people who's going to do it or live it daily. You got trust that's still, tenuous at best, but it's better developed because you're talking to each other and working together. And then the third thing is when you come into a situation where somebody's going to make a mistake or do something or say something wrong or say something that people think is just bias, you got that trust account built up and say, you know what, that was wrong what James said and did. But you know what? He been rocking with us for 2 or 3 years now trying to solve this problem. We see him in community every day. We see him spending his own money, bringing his daughter to the community to buy vegetables here, working with us. Now I'm going to even partner with him even more because I know it came from a place of ignorance as opposed to intentionality and discrimination. So I think those things will help bring together the better trust in community with healthcare that will lead to longer term solutions.
Right. I I wanted to go back a little bit to the part where you talked about food deserts and what you saw in Detroit. Um, I've been amazed lately because people have been asking me about moving to Detroit, and I'm looking at them like, "You want to move to Detroit?" And they're so enamored with what goes on downtown. Now, I actually got lost downtown the last time I went because I'm like, "Where? What? This this don't look like nothing that I was skipping when I was in school." Like everything is different. And
Uh,
but when you I had to take that Grand River bus. And when you ride down Grand River to get to downtown, it made me want to cry. There is nothing there. There are no hospitals. There's no little doctor's offices. Yes, there's some things downtown, definitely food deserts. And just the poverty is everywhere until you get downtown. So that's just a really sad portion. And do you know about any initiatives in Detroit? I know you aren't there, but
mhm. Well, I do. So, speaking of moving back, my sister just sold her house in Houston. She's moving back to Detroit.
ah,
She's going to live downtown. My mom lives downtown. She's been there since 1984. She used to live
wow.
next to Joe Louis Arena, and she still lives there, although Joe Louis Arena doesn't exist anymore. But you're right. I go home and I see all the downtown riverfront. I see there have a walkway that goes to the Renaissance to Belle Isle now, and it's amazing. And you see lots of it. I'm being just candid and direct. You see a lot of white people that I never saw before in Detroit that are now downtown with dogs, apartments, cars, eating breakfast. And there's nothing wrong with that. But you go 5 minutes up Grand River or 5 minutes east up Van Dyke or Jefferson and go to the neighborhoods, and you have neighborhoods with no houses, no grocery stores, no doctor's offices. So that has to change. So I'd say, and hopefully Detroit is doing this. For every dollar or two they put into downtown, that someone's saying, you know what? We need to put some of those same resources into the communities and rebuild some of those neighborhoods. Now,
Mhm.
will say I'm impressed that some of the neighborhoods that are on, get to a Detroit now, on Woodward headed west, where my mom grew up, have been developed a little bit more. But the
Yes,
pricing of the housing is outpacing the ability of people to pay for it. So we got to
right.
figure that piece out with jobs. But hopefully those things are still being addressed. But you're right. Gentrification has happened in my city of Detroit. Hopefully, some of the people who are being gentrified will get opportunities to still get housing, to still get employment, and invest in the community as well. Because if you don't, you got a long term problem. You talk about healthcare, you then talk about a long term problem about people dying in community,
Mhm.
kids not getting the things and services they need. And what happens is disease doesn't say I'm only going to stay in one area code, the zip code.
Right.
Disease goes through the entire city, the entire state. We saw that with COVID. It didn't just stay in one pocket, it spread throughout because of those disparities and lack of investment. So, yeah, I love my city. They got to continue to do better. And we're going to get you a guide next time you go to downtown Detroit. You won't get lost.
I really was amazed. I couldn't believe it. I just say, I thought I knew downtown like the back of my hand. Not.
Well,
It's
Cass Tech's still in the same place. It's a different building, but it's in
a
the
different.
same place.
Yes, definitely a different building. I just want to cry every time I look at it. It's pretty.
It is. It's pretty. It's
It's
pretty.
pretty,
Good.
but it's not the same.
True. That's true.
What I've been asking you all of this, and the show's Leadership Beyond Burnout. Have you ever experienced burnout in your leadership as diversity, equity, and inclusion officer in trying to spread the word, or no, you've been energized the whole time?
Uh, I'm about to call you girl. I was like, girl, you know I've been burnt out. Doctor Kimberly.
Call me
Yes,
girl.
as a black man in America, I've been burned out a lot over the years, my 56 years of living. To be quite honest, for the first time in a long time, I'm learning what it means to have some time for yourself and self care. Like I didn't grow up hearing self care. My dad never mentioned to me self care. He didn't have time for self care. My mom didn't have time for self care. Their care was taking care of their kids, their family, our safety, putting food
Right.
on the table. So that was the mindset I lived in. So at some point in my life, I got to a point where I was just tired and burned out. And this was even before diversity, equity, inclusion. I was practicing law,
Hmm.
um, and just had been burned out, and just say, you know what, is this all worth it? And didn't go to any mental health providers, didn't even go to any psychologists, psychiatrists, because we were never taught that. We were never said, as a black man, if I'm feeling this way, I should go to get some help. Like help, You just say, "How you doing, man? I'm cool," you know, or you greet somebody with our phrase that we always use, "What up, though," which means don't ask me no questions. I will tell you no lies, and don't ask about my soul and my physical and my mental well being. So all that said, yes, been burned out plenty of times. Have gotten better at this age. Still not perfect yet, and not even close to it. But I will allow myself to say, you know what? You need to shut it down now. You
Mm.
need to have some self care things you're doing. Like I've taken on travel for music recently. Like last year, I went 5 different places outside of Minnesota to hear concerts and events and that kind of thing. I love music, always have, but it gets me out of my comfort zone, out of a place where people can ask me questions all the time and keep me at work, and just go somewhere and just do something for me. So I'm
Yeah.
learning more about self care to prevent, hopefully, many more burnouts, but at least acknowledging the fact that it was a burnout, and before I never acknowledged that, I had thoughts of not wanting to be here and taking my own life, and that was something that I never addressed or would have thought about addressing. But now I'm like, you know
Right.
what? If you get help from people, if you talk to somebody, if you acknowledge those things have happened, you not only help yourself, you help others as well who may be dealing with it. I have a lot more black male friends now that we talk about substantive things more than just sports. We're like, you know what? We can talk about family. We can talk about relationships. We can talk about, man, I'm scared about this, or I need some support. Whereas
Right.
growing up as a kid, you just taught to be, as a black male in Detroit, you just taught to be hard. You just taught to be, don't say nothing, and you be all right. So and
Right.
don't cry. Don't cry at all. So
Don't cry ever. Now, correct me if I'm wrong. Isn't Omega Sci-Fi doing some things specifically around men's mental health?
we have a program that's specifically designed for men addressing their mental health and wellness. I'm gonna get the name of it wrong, so one of us got to look it up before I get on here, and the brothers be like, "How you messed up the name of the program?" But it's the theme of it is being my brother's keeper.
Mm,
And the theme of it is addressing those needs by having those conversations that I just talked about, having mental health professionals who are part of our fraternity provide that counseling and guidance. We have groups on a regular basis. Some are virtual, some are in person, that address the mental health needs, and just having a venue or opportunity for us to talk about those things. And then also be examples to our young men in community who either want to be aspiring Omega Sci-Fi men or just be in community, that it's okay. It's okay to cry. It's okay to be vulnerable. It's okay to to not always be hard in your relationship with your woman. It's okay to tell your mom you love her and tell your dad you love her. It's okay to hug and kiss your daughter and realize that, you can be the protector, but also be soft enough to be like, you know what? You can do that with your daughter and your son. Those are things that we're learning. So, yeah, that program has been going on. Our 10th district representative, Sean Long, is doing great work in the regional level, what's called our district, and also to our national organization is doing great work around that too. So thank you for that shout out, and I'm gonna get the name of it before we get off the air too. So
Okay, absolutely. What are there any books that you're reading that are inspiring you now, or any movies that you've seen that?
so American Fiction is a movie that I had to watch twice. With
Yes.
Jeffrey Wright. Because the first I watched it, and I was like, well, let me back up. My boy told me it wasn't that good, so I walked in with a lens of it ain't that good. So I watched it, and I walked out like, it's all right. But then I was like, let me watch it again with a clearer lens, and I enjoyed it more. The nuances of relationships, the nuances of equity and inclusion, and what it looks like, and how people want to see us sometimes. Was amazing and revealing. So I enjoyed that movie. Books. I want to read a book called Legacy by Dr. Yuchi Baylock. She's a medical doctor who left her field because of racism.
Mm.
And she candidly tells the story in the book Legacy. I haven't read it yet, but I want to read that book soon. I have a lot of audiobooks that are in queue, and I get
Oh, quit talking about me.
I have not made any. Like I said, I got probably so many audiobooks I can listen to now to next year sometime, but I have not pulled the trigger on those. So I need to get better at that. But life takes over, and I think for me, in addition to reading, I want to create experiences. So I want to, go different places, meet different people. My goal this year is to go to like 4 or 5 different countries as well, and just experience that as well. So yeah, those are the books and the movies that I've seen lately.
Okay, beautiful. And what I'd like to give you the platform to do it, you had to issue a challenge to those in healthcare organizations to improve healthcare equity. What would that challenge be? Where would you want them to take up the mantle?
Good question. Ooh, so where will the challenge be? I guess the challenge I would say is create a space where you would want your child to be when he, she, or they felt vulnerable, unsafe, insecure, sick, maybe even gravely sick. But you want to create a space where they felt like everything is being done for them to heal, not only from a physical standpoint, but from a mental and social emotional standpoint as well. So in healthcare, think of that space for your child, and that you want to create it for your child and your family. And then as you operate on a daily basis, if you are doing anything, whether it be unintentionally or intentionally, or the system is doing something to not create that space for your child, realize that it's doing that for other children as well. And that we can create a system that makes it so those children feel, and your children, valued, included, well taken care of, served, and loved upon as well. I think the second part of that is also create a place where you want people to come and want to be able to work in a place. We call our staff the kid experts, and be the kid experts without any barriers of being treated differently or looked at differently because of who they are and what they bring to the table. And not everything has to be the same way which we've done it before, but new ideas are welcomed, new strategies are welcomed. Innovation is not pushed aside, but it's truly welcomed. New languages are welcomed. And the more you don't understand, the more uncomfortable you get, the better the idea is going to be, because you don't know it, you haven't seen it, you haven't heard of it before. And it's something you're willing to embrace because you're going to create an environment that those people will serve in a way that I talked about earlier, those kiddos, that they have a wonderful experience. So that's what I would create if I had a magic wand.
Oh, that's a beautiful sentiment. I did you want to share the name of that program exactly?
Well, I told you earlier I took put my contacts in. I'm having contact problems, so I can't see it discreetly what I'll put on 15 font. So we're gonna have to get back to you on that name of that program. But it is Omega Sci-Fi mental health program. I believe it's my brother's keeper, to be honest. That
I
we are.
believe that's the name I think I saw.
Yeah, I think that's it. To be quite honest, and it's something that a lot of. I mean, we give credit. A lot of other fraternities are doing it as well, and sororities as well, because mental health is something that we've shunned in the Black community for a long time, and we've called people crazy, and we put them on our own family. We just said, "Oh, that's just crazy Joe. That's just crazy James," and got them no help. We just put them on the corner, gave them a plate, whatever, and didn't address that. And then years and years and years and decades and generations of that have festered. And now I'm glad that we're at least addressing it and realizing that it can be treated, and that doctors like yourself and others can provide counseling for that, service for that, and address that need.
Beautiful sentiment. Thank you again for being here.
Thank you.
And let me thank you everyone for being here. I'm Dr. Kimberly L. Wilson. You've been watching Leadership Beyond Burnout. You can see us every Thursday here at 5 p.m. Eastern and 2 p.m. Pacific. And until next time, I'll see you later.